activities for the Psychosocial Disability Month. Thank you for joining us in this conversation we'll be having on understanding psychosocial disability. My name is Zole Kalimakwe, and I am the mental health trainer for the South African Federation for Mental Health. Just an overview on what we're going to briefly discuss. We're going to do definitions, stigma, misconceptions about psychosocial disabilities, risk management and risks, and how you can manage psychosocial disabilities. All right. With the world's attention on COVID-19, the past couple of months have been very challenging, and there hasn't been any much data that has been given in terms of seeing how the pandemic has affected the mental well-being of people. But experts do give us a warning that the global emergency could have a sweeping effect on the mental health of the population across the world, especially to those that have already been diagnosed with psychosocial disability or those who are at risk for developing psychosocial disabilities. When we're talking about psychosocial disabilities, we are referring to the environmental barriers that prevent a person diagnosed with a mental illness from participating in their community, fulfilling their day-to-day tasks, such as working, caring for themselves, going to school, or going to work. These mental illnesses could be bipolar, schizophrenia, depression, and so forth. Psychosocial disability can be caused by a number of mental illnesses, but the presentation of these illnesses can be characterized as a combination of abnormal thoughts, perceptions, emotions, behavior, and how we relate to other people. Looking at the global overview on psychosocial disability, psychosocial disabilities are a leading cause of disability across the world. Globally, 284 million people are currently living with anxiety, and 264 million people have depression. In South Africa, 1 in 6 people are affected by anxiety, depression, substance abuse, and 40% of persons living with HIV have a diagnosable mental illness. We cannot run away from stigma, all right? Stigma is defined as a stereotype or a negative view that is attributed to a person or groups of people when their character or behavior is viewed differently from what the society or the societal norm. Persons with psychosocial disabilities experience preventing barriers that someone who doesn't have psychosocial disability cannot relate to. These barriers cause that person with psychosocial disability to have restrictions in exercising their rights and in participating on participating in their day-to-day life, because their disability, the psychosocial disability, is perceived as an impairment. Looking at the misconceptions and about psychosocial disabilities, there are myths, but I'm also presenting the truths. So some of the myths about psychosocial disabilities are that someone with a psychosocial disability cannot be gainfully employed, they should be institutionalized, they're not productive, that they are a danger to the society, and they are violent. However, people with psychosocial disabilities are no more violent than the general public. In fact, a lot of times they are the victims of violence that has been shown upon them. The many times someone with psychosocial disability actually avoids seeking help because of stigma. And we just have to remember that anyone can develop a mental illness. No one is immune to mental health problems. Some of the risk factors of psychosocial disabilities are societal factors, the cultural background, the economic state, poor working conditions, lack of support, and a poor standard of living. With the biological factors, we're looking at the genetic predisposition, poor nutrition, environmental hazards, stress, and prenatal infections, amongst others. So there's more than one risk factors that can be mentioned. With the current situation that we're facing as a pandemic all over the world, with COVID-19, there are a lot of risks that have been created by COVID-19. So they also influence the mental health. So let's just have a look at the risks that are unchecked of mental health during the COVID-19. The first one, there's an increase on suicide risks. This is seen in severe cases of mental illnesses that lead to suicide. And these factors that influence suicidal ideation or suicidal thoughts are the economic stresses, feeling of loneliness, the isolation, reduced barriers or reduced community support, and not having access to the mental health treatment centers or mental health services. COVID-19 has been a fertile ground for stigma. Apart from people with pre-existing mental health issues, they have been vulnerable to the pandemic. So individuals who also contract the COVID-19 have also faced similar stigma. So imagine if you have a mental illness and now you have COVID-19, so you are facing a double stigma. There are a lot of risks that our frontline workers are facing. Mental illnesses and burnout are always in the topic conversation in terms of the mental health of people who work in the in the health field. The current emergency is adding work-related stress to the healthcare workers who look after the patient's needs before their own safety. When we're looking at other influences that can put a person at risk, things like alcohol, tobacco, and drug misuse are very harmful. It has always been associated with stressful times as people use these substances to cope. Obviously, they're coping negatively. Drinking alcohol weakens the immune system and reduces the ability to cope with your body fighting infectious diseases. Alcohol can also influence a person's mood, which then leads to someone displaying depressive symptoms or being anxious. People in the treatment facilities and the institutional care are also at great risk. With the lack of communication or the COVID-19 being communicated in a language that they understand and the support that they would need, this worsens their mental health problems as they're always anxious. There's a compromised access to mental health services, which creates a risk. With the pandemic limiting or rather just not having access to certain psychosocial services, this has created a barrier and a risk for those people that are not able to access their services or their medication, and they only have access to the psychologist or psychiatrist with voice notes or voice phone calls, video calling. But for those that are in poor networks, in rural areas where the network is just poor and there isn't connectivity, this creates a greater risk for them as they're not able to access those services that they need. So psychosocial services, psychosocial disabilities does not mean the world comes to an end. There is a way to manage, but provided that the access is available. It can be managed through medication, psychotherapy, as well as occupational therapy. But the most important is for recovery is the connection that you have with your friends and your families, the support and the understanding that they show. So continue with your routines and your structure, work on the self-esteem and the self-worth, have a positive mindset and a healthy lifestyle. Thank you so much for joining us. I know it was a short discussion on understanding psychosocial disabilities. Thank you. Look after your own mental health and help to look after the mental health of those around you. Should you guys have any questions, please do send us your information, your email address on the following contact list. Thank you so much.